Bismillahirrahmanirrahim. Quote of the day: occupational safety and health is vital to the dignity of work. Assalamu alaikum, everyone. I'm Dr. Amna Khan. I'll be presenting today ergonomics and setting up of occupational health services under the kind supervision of my most respectable and honorable supervisor, Dr. Saira Afzal. Learning outlines, introduction, dimension of ergonomics, risk factors and solution, basic occupational health services, recent updates, MCQs. Learning outcomes. At the end of this presentation, participants will be able to describe the ergonomics and their dimension, risk factors, solution, and recent updates. Ergonomics, the scientific discipline concerned with understanding of interactions among humans and other elements of a system, and the profession that applies theory, principles, methods, and data to design in order to optimize human well-being and overall system performance. Ergonomics means fitting the job to the worker, including workstations, tools, equipment. Dimensions of ergonomics. Physical ergonomics, it is mainly physiological interactions of people and their activities that are concerned. Improvements are sought in the fields of posture, body manipulations, carrying heavy weights, movements, especially repetitive ones, the configuration of workstations, safety procedures, and health in general. Cognitive ergonomics deals with the mental, intellectual, and psychological aspects of the operator activity relationship, perception, reasoning, memory, stimuli, and psychomotor responses, etc. The improvements related with cognitive ergonomics have to do with performance issues, decision making, management mistakes, or stress. Organizational ergonomics. This type of ergonomics focuses primarily on the structural issues of professional system, organization of a process and operational regulations. Its privileged contacts are human resources managers. They work in particular on issues related to timetables, working rhythms, modalities of activity. Injuries. Overexertion, leading cause of injuries, most costly, recurring persistent pain may develop in future. Bodily reaction is another leading cause of injuries in workplace. Repetitive motion also motion also within top 10 most common workplace work injuries. Musculoskeletal disorders affect the muscles, nerves, blood vessels, ligaments, and tendons. Symptoms include discomfort, pain, numbness, loss of motion, flexibility, spasticity, and stiff joints. Most common musculoskeletal disorders are carpal tunnel syndrome, tennis elbow, bursitis, ischemia, sciatica, herniated disc, neck strain, disability, tendonitis. Affected areas include most commonly back, arms, elbows and shoulders, neck, hand, wrist and fingers, knees, ankles, and feet. Risk factors of musculoskeletal disorder injuries include: they depend upon work positions and postures, how often task is performed, level of required effort, and duration of task. Prevention. Method of protecting against the MSDs: establish ergonomic program, training, feedback from all levels, conduct job hazard analysis, early recognition and reporting of potential musculoskeletal disorders. Examples of engineering controls: workstation design and setup, ergonomically designed tools, ergonomically designed equipment, load weight reduction. Examples of proper work practices: proper lifting techniques, team lift, heavy, bulk, awkward loads, stretch, work rotation, task variety, increase rest breaks. Examples of the personal protective equipments include gripping gloves, knee pads, vibration gloves, thermal gloves, lifting straps, shoulder harness, and the lifting braces. Physical hazards: reaching above the head or the shoulders, working with the hands above head for more than 2 hours per day, working with the elbow above shoulders for more than 2 hours per day. Solution: keep items within close reach, elevate work areas, remove obstacles, utilize equipment to raise and lower items or move items closer to worker. Physical hazard: awkward body posture, working with the neck or back bent forward more than 30 degrees for more than 2 hours per day, sweating for more than 2 hours per day, kneeling for more than 2 hours per day. Solution: raise and or tilt the work for better access, use a stool for ground level work, use tool with longer handles, alternate between bending, kneeling, sitting, and squatting. Awkward grips: gripping 10 or more pounds of force for 2 or more hours per day. Solution includes: design work layout to reduce hand carrying, reduce amount of items carried at one time, use non-pinch grip postures, use ergonomically designed tools aids, and use job task rotation. Repeating same motion for more than 2 hours per day with hands, wrists, elbows, shoulders, or neck. The solution would include: arrange work to avoid unnecessary motions, let power tools and machinery do the work, spread repetitive workout during the day, take stretch pauses, rotate tasks with coworkers if possible, change hands or motion frequently. Heavy, frequent, and awkward lifting. Solution includes proper planning, minimize lifting distances, position materials to power zone levels, avoid manually lifting, lowering loads to form from floor, identify or reduce the unstable or heavy loads, reduce frequency of lifting and duration of lifting tasks, provide clear access. Occupational health services. The basic occupational health services are an application of the primary health care principles in the sector of occupational health. Primary healthcare definition can be found in the World Health Organization Almaty Declaration from the year 1978 as the essential healthcare based on practical, scientifically sound, and socially accepted methods. It is the first level of contact of individuals, the family, and community with the national health system, bringing healthcare as close as possible to where people live and work. An effort was launched by the International Commission on Occupational Health to develop basic occupational health services. Occupational health services are available to only 10 to 15% of the workers worldwide. Surveillance of work environment and risk assessment. The surveillance of the work environment is one of the key activities of basic occupational health services. Ergonomic factors which might affect workers' health, condition of occupational hygiene, and factors such as physical, chemical, biological exposures, which may generate risks to the health of the workers. Exposure of workers to adverse psychological factors and aspects of work organization, risk of occupational accidents and major hazards, collective and personal protective equipment, control systems designed to eliminate, prevent, or reduce exposure. Health examination, pre-assignment, pre-employment health examinations, periodic health examinations, return to work health examinations, general health examinations at termination or after ending of service. First aid and participation in emergency preparedness. The first one includes providing first aid services at the workplace when appropriate. Second one it includes introducing and training first aid practices to workers and supervisors. At number 3 is maintaining and periodically inspecting the first aid readiness and facilities. Number 4 includes participating from the health point of view in emergency planning and organizing the health elements in emergency response. Diagnosis of occupational diseases. Identification of exposure which may cause the disease, examination of clinical findings which are known to be associated with the specific exposure, exclusion of non-occupational factors as a possible cause of disease, statement on occupational disease for workers' compensation, proposals for preventive actions to the workplace of the work in concern, notification of occupational disease to authorities. Record keeping, general health record if the workers are treated as patients or health services clients, data on surveyed, detected, and measured occupational exposures and risk assessments which have been made, statistics on occupational diseases and injuries, data on health examinations, documents on proposals for preventive and control measures. Now it's time for the recent updates. Certain laws at national level have been introduced. There are some of the laws: the Factory Act 1934, the Boilers Act 1923, the Explosives Act 1884, the Petroleum Act 1934, the Dock Laborers Act 1934, the Workman Compensation Act 1923, the Boilers and the Pressure Vessel Ordinance 2002, the Mines Act 1923. The Punjab Labour Policy 2015 has also been introduced, and there is Pakistan Occupational and Safety Act 2018. Pakistan Occupational Health and Safety Act 2018 is an act to ensure safety and health working conditions for the people at work by authorizing enforcement of the rules and regulations developed under the act, by assisting and encouraging the organizations, institutions, and geographic areas governed by the federal government in their efforts to ensure health and safety working conditions by providing for research, information, education, and training in the field of occupational and health and safety. Global Plan of Action on Workers' Health. WHO Global Plan of Action on Workers' Health 2008-2017. There are some baseline for implementations. This plan links occupational health to public health by identifying the following objectives for global action: to devise and implement policy instruments on workers' health, to protect health worker, to improve the performance of and access to occupational health services, to provide and communicate evidence for action and practice, to incorporate workers' health into the other policies. The impact of ergonomics on children studying online during COVID-19 lockdown. The children spent longer hours on gadgets, on laptops, 58%, Android, Apple phones, 20%, desktops, 12%, tablets, 10%. Their content on gadgets was 45%, curriculum 45%, 35% games, and 20% others. Study revealed that parents were unaware of ergonomics and effects on their children. Very few parents understood the correct sitting posture, 6%, eye monitoring, 1%, laptop ergonomics, 3%. But only 1% of subjects suffered upper back pain, 18% lower back pain, 13% eye strain, 11% headache, 6% had irregular sleep, and 6% behavioral changes. Effect of wrong posture doing work, repetition, loading, and probable cause for pain were discussed in the paper. Now it's the time of the time for the MCQs. Number one, pre-placement examination ensured that your prospective employee can safely perform the job they are applying for. One of the statement about pre-placement medical examination is not true. A, it is done to assess the fitness of a person for specific job. B, conducted only on those who are concerned with public safety, used for record keeping. D, gives baseline information for health. E, none. Anyone? It's
B.
Yes, it's B. Number two, global plan of action whose mandate is to advance social and economic justice through setting international labor standards. The main objective of global plan of action about occupational health is A, promotion of well-being, B, protection of workers, C, placing of workers at appropriate place, D, providing treatment to workers, E, no protection of workers.
B.
Yes, it's B, protection of workers. Number three includes worldwide, there are many types of accidents related to occupational health hazards. Most common type of injuries related to occupational hazard includes musculoskeletal injuries, A, B, burns, C, fractures, D, cancers, E, tumors.
Alpha.
Yes, it is alpha. No, it's alpha musculoskeletal injuries. Number four, in XYZ factory, there is proper design and setup and ergonomically designed tool. Which type of control method is used in this factory? A, engineering control, B, personal protective equipment, C, administrative controls, D, proper training, E, no intervention.
A.
Yes, it is A. It's
B.
it's A. It's engineering control, as discussed previously in the slides as well. MCQ number 5, a man worked in workshop in kneeling position more than 2 hours and he complained of pain in knee joint. Which type of personal protective equipment recommend for this person? A, thermal gloves, B, knee pad, C, vibrating gloves, D, lifting straps, E, cord gloves.
B.
Yes, it is B, it's knee pad.
B.
Number 6, in some area of factory, there is use of repetitive motion for completion of tasks. Administration design that work ergonomically. Which type of plan cannot meet that task? A, change hand motion frequently. B, use machinery to do work. C, use personal protective equipments. D, rotate tasks to co-workers. E, do not use personal protective equipments.
B.
No, it's Charlie. MCQ number 7, in the context of occupational environment, the discipline which is used for fitting the job to worker is commonly known as A, ergonomics, B, ergometric, C, pre-placement, D, biometric, E, post-placement.
A.
Yes,
A.
it is. Number 8, the dimension of ergonomics which deal with performance issues, decision-making or stress-related problems of workers. This statement comes in which domain? A, physical ergonomics, B, cognitive ergonomics, C, organizational, D, occupational, E, non-organizational ergonomics.
B.
A.
It's B, cognitive. 9, dimension of ergonomics which privileged contexts are human resources managers and issues related to timetables, working rhythms, modalities of activities are sought out. Which type of dimension this is? A, physical ergonomics, B, cognitive ergonomics, C, organizational, B, occupational, E, behavioral.
C.
C.
Yes, it is Charlie. It's C. Organizational ergonomics deals with such kind of dimensions. Number 10, medical examination is necessary for workers, which examination ensure that your prospective employee can safely perform the job they are applying for. A, periodic examination, B, pre-placement, C, examination at termination, D, general health examination, E, non-periodic examination.
B.
B.
Yes, it is B, pre-placement examination. Here's the key for the MCQs. Here's the references. Thank you so much, everyone, for listening. And this is the link of the YouTube channel. Please like and subscribe. Thank you so much.